Hi, I'm Denise Earhart, Economic Development Director for the City of Maricopa. And today we're visiting with Maricopa Smiles. This is a place where you can get the perfect smile. Who doesn't want that, right? Let's go check out what Dr. Ahmadieh has to say.
Hi, welcome.
Thank you. This is a beautiful office.
Thanks for coming. We appreciate you coming in. We try to create a nice, warm environment for our patients. We provide comprehensive care for our patients. Anything and everything dental related, we do provide. So I'll give you a little tour here. First, I do have a team of specialists that come to my office.
Oh, perfect.
So Dr. Cho and I, we are the general dentists here.
Okay.
And we have a team of specialists that come to our office. They help us take really good care of our patients here. So come on this way, I want to show you. Technology is a really big part of our practice. Healthcare, and especially dentistry in general, is really evolving.
So what are we looking at here?
So this is called a CEREC machine. This allows us to make crowns in one single visit. We used to make crowns, make a temporary, take a gooey impression, wait 2 weeks for the lab to make it. This technology actually allows us to make a crown in one visit, less than 2 hours.
So no more of that big gooey thing that goes and touches your tonsils.
No more of that, no more getting on that. So, you know, you brought up comfort for a patient. This makes it so much more comfortable for our patients.
So how often should someone have x-rays done?
It's recommended that patients come in on a 6-month basis for checkups. And depending on their oral health, that can vary, usually on average every 6 months for a couple updated x-rays.
And what's too soon to visit the dentist and what's too late? Or is there ever a too late?
No, it's never too late, and there's never too soon actually. I see little kids as young as 1-year-olds come in, and it's more educational for the parents, of course, but like you said, you know, the dentist office is so scary in some people's minds. So when you get exposed to it as a 2-year-old or 3-year-old, it's like going to the grocery store and picking up a loaf of bread. You're used to the environment. It's really easy for you. So this camera here actually allows us to take images of the patient's mouth. And you can see here I've designed a crown to the ideal anatomy for the patient. And this machine actually communicates with the machine we saw earlier to allow it to design, to mill it out the way I designed it here. We do have 11 operatories, and you can see this room actually allows us to see families together. When you look here, these doors actually open and close, so if we have a family of children or whatnot, you know, a daughter or son may be here and their parents are right there, so they can see each other, be able to communicate, so it's really comfortable for our patients to be seen here.
And I know another question that's really important to the patients is, what can they watch on TV?
Well, we do have direct TV.
Okay.
So we have a plethora of channels.
You know, for some people, this could be a little break, a little getaway. So if they can watch their favorite show while getting their teeth cleaned, that's not bad.
This room in the corner is a larger room. And this is where our specialists see our patients. Okay. And so we call it our surgery room. I have a few specialists that I work with. I have an oral surgeon, an endodontist, a periodontist, and an orthodontist. They all come here.
So essentially, I don't have to go anywhere else. I could, if I needed braces, my children needed braces, they could come here.
Exactly.
That's wonderful.
Exactly, and we can do the checkup and the cleaning the same days.
So I thought when you said comprehensive, it was just sort of cleaning and anything maintenance, but this is a bit more.
A bit more. So for instance, let's say your son or daughter needs their wisdom teeth taken out. Our oral surgeon does that here in the office. And they come a few times a month, so it's great. You don't have to commute. Everything is done here.
Why did you choose Maricopa?
That's a good question. Maricopa really stood out. It's a very tight-knit community, which is different from the Gilberts and the Chandlers. So different. And it's growing so much. Be able to bring services that weren't necessarily available. So by bringing in those specialists, I'm able to offer my patients comprehensive treatment. So I love Maricopa. I'm so happy to be here.
We're happy to have you.
Thank you.
Why should people shop local? And I think of going to the dentist as shopping local.
Maricopa is growing so much, and what's important is that our economy is growing, not just residents, but also the economy itself. And by doing so, it attracts businesses to come in, provide more services and merchandise here in Maricopa. So we're not having to commute into the Phoenix area. Most of my employees, they live here in Maricopa, and they literally takes them 2 minutes, 5 minutes to get here. So they get to spend more time with their families.
So how can people find Maricopa Smiles?
We are located in the Wal-Mart shopping plaza, a little strip in the Wal-Mart parking lot area. So we're pretty easy to find. Our phone number is 520-568-2800. Our website is very accessible. Just Google Maricopa Smiles. And then you can schedule an appointment through the website, give us a call. The website describes a little more detail what we talked about as far as what services we provide. It's pretty accessible that way too.
Wonderful. Well, thank you for being another Maricopa business investing in our community.
Thank you for coming. I really appreciate it.